They have cancer 24 hours a day, 7 days a week, every day of the year.
It was overwhelming because you're pregnant and you have a 9-month-old at home with another one on the way, but we knew right away that we were in the best care possible. I'm glad that they're there and got me in right away.
The 24-hour cancer clinic is an oncology-specific urgent care for the health system's patients on the Fredericton MCW Frederick Hospital campus. Patients still need to go to the emergency department for chest pain, stroke symptoms, and other serious conditions, but for cancer-related symptoms, all they need to do is call their doctor for a referral before going to the clinic.
The 24-hour clinic was created to make sure that our patients had the support that they needed at all hours of the day, night, weekends, holidays, and to know that somebody was always there for them.
Over the last few years, as our patients started getting more and more complex care in the outpatient environment, what we noticed was that we did amazing things during the day when the clinic was open. We were able to see the patients in our clinic setting. We have an infusion room that's open 10 hours a day. It's also open on the weekends. But as soon as clinic closed or the infusion room was closed, then the patients ended up having to call the answering service. And if something was needed in the evening, they had to either wait to come to clinic the next day or they ended up in the emergency room. The clinic opened in November of 2016. And we had all sorts of hypotheses about what would work, what wouldn't work, what would be barriers, would the patients like it, would they not? And I would say it was successful, probably beyond our wildest imagination. We've been able to see the impact to the patients, not only from a value standpoint, but to their satisfaction with the area, their ease of accessing the clinic, but most importantly, and I think truly beyond anything we could have ever imagined, is the kind of overwhelming sense of relief that we hear from our patients and their families to say, I'm so glad this is there.
By putting them and keeping them in front of an oncology trained provider, we've decreased the amount of testing we're doing. We're not duplicating things. We're not repeating their imaging or their labs. We're really only doing what we need. We're also more familiar with their treatments.
The beauty of it being open 24 hours a day is that they can stay. They can stay 10, 12, 14 hours. And we have great examples of patients that really would have been admitted in the middle of the night that we can now bring into the clinic, we can stabilize, we can provide care to get them comfortable, and then their physician is able to see them early the next morning and ultimately make that decision of whether or not they really need to be admitted for further care or if they're able to go home.
We also do ancillary support. We have a lot of treatments that we're pulling out of the inpatient setting. As insurance and payers are challenging us to do more and more complex treatments on the outpatient side, we have patients on the outpatient side who were sicker and that we always historically have kept inpatient, and now they're at home on home infusion pumps and they're got chemotherapy running at home, and so when they have issues with that, we're able to help them during the night, where previously we may have had to tell them to turn that lifeline off until the clinic opened in the morning.
These patients spend a lot of time here already. They've already spent a lot of time in the hospital. Some of them have been hospitalized for weeks and weeks, as through the course of their treatment, and if they can avoid another trip into the hospital or another all-night stay in the emergency room, from a quality of life standpoint, that's huge for our patients.
Lauren's breast cancer treatment continues with chemotherapy and soon surgery. She's positive and ready for what's to come, grateful for the support of her care team.
I know that when I'm leaving that I was taken care of, and I can call if there's any issue with side effects, and they're there.